I guess we can both get started. So I'm Matt Cave, and Mike Merchant is here, and so we've been asked to put together this little symposium on the research voucher programs from the CIEHS. So first part of this talk, we'll kind of tag team and give an introduction to the center. I know everyone in the room is very familiar with the center, but there may be some watching on the recordings that are less familiar, so I'll give just a quick overview of the center, and then talk about the voucher program from the IHSFC. Then Mike will give an overview of the Item FC voucher program, and then we'll jump into some presentations by some of our awardees who have been highly productive. Anything else to add? Okay, so the CIEHS is a environmental health science core center, and you can see on the map, Colleen may know the number, is 20-something, I guess, 25 centers, and we're among the newest of them. This is a program by the NIEHS supporting 4 main goals: to advance environmental health research, promote community engagement, and we're happy to have our community engagement core leaders here as well. Advancing translational research, which is part of objective of the IHSFC voucher program, and then training new researchers, and then bringing in new to environmental health science researchers, which we've done with some of our vouchers as well. And so the Center for Integrative Environmental Health Sciences has a theme and a long-term objective. And so this is something that's very important for this P30 center program, because there's many requirements that are the same across all centers. And so in terms of differentiating your center's identity, this is very important. And so our center leader, Dr. States, and other leadership developed this theme of integrating pollutant exposures and lifestyle factors. And so Kentucky's a great place for this because we have high smoking rates, high obesity rates. We had a visiting professor in town a couple weekends ago and went for bourbon tour. So I'm sure, as most of you are aware, there's more bourbon barrels than people in the state of Kentucky. So high levels of alcohol consumption. And then we have several Superfund and other polluted sites in the state too. So this is a perfect place to explore that lifestyle and environmental pollution interaction, which can be in turn modified by life stage and sex. And so we have several goals of the center as a whole, and that's to promote interdisciplinary collaborative research, to promote community engagement and community-based research, and then translate basics research findings and engage physician and population scientists. And so this is a schematic of how the National Institute of Environmental Health Sciences defines translational research as kind of a solar system with different rings and different nodes on the rings. And as you start in the beginning, center ring, it's in vitro or in vivo studies, and then going out to human subjects, populations, and then ultimately changing outcomes in the population or in clinic or economic outcomes. And so translational research is defined as not only just crossing rings, but going around nodes in a ring. So it's a very big, big, broad definition. And so we're use that definition in the center. And then again, we feel very strongly that it's important to recruit both new and established investigators to environmental health sciences. And so our first talk, for example, will be by Dr. Jofflin, who was new to environmental health science investigator, and other examples too. So leadership of the center is kind of a complicated design. All these centers are that way, but it's a core facility center. There's multiple research support cores and interacting with community too. And so the overall center is led by Chris States. And so today we'll be talking about 2 boxes out of the total number of 10 or whatever boxes there are. And that'll be the Integrated Health Science Facility Core, which I direct, and then the Integrated Toxicomics and Environmental Medicine or Measurement Facility Core, which Dr. Merchant directs. And so each of these has a research voucher program meant to subsidize research to support the overall objectives of the center. And so the IHSFC Research Voucher Program has small, medium, large vouchers and application cycle listed here. So the next one will be due the second Friday in January, and online. This is where you go to get more information about how to apply. And so we're supporting clinical and translational research through this voucher program. And remember that the translational research is defined by this NIEHS translational research framework. So even something like for basic scientists, like going from a mouse model to a human cell culture model, that's translational research according to their definition. And so these are the vouchers that this IHSFC has awarded to date. The first was Dr. Joughlin awarded February 28, 2021, and then Dr. O'Toole, June 8, 2021. Dr. O'Toole's application actually came in the first. He was the first to apply, but had to wait a little bit because he had an active award, and so there's a limitation on how many active awards you can have within the center. So he was the first to apply, but second to be funded, and we appreciate his application. And then Jai Ping has the latest, and we're very excited about his application and bringing him into the center. So he's following what I think kind of Aruni and others started with environmental cardiology, and then I kind of picked up environmental liver disease or environmental hepatology, and Jai Ping is now the first environmental anesthesiologist that I know of in the country. So I'm excited about him. And I'll turn it over to Mike to talk about his forward voucher program.